Physical therapists, occupational therapists, speech therapists, we are very used to being, connected to that patient. And sometimes we have to be to help them walk, to help them eat, to help them bathe, dress.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
Now, how long has Hillside been operating?
Hillside, as an inpatient rehab hospital, has been here for over 55 years.
What is the range of services that you provide here at Hillside?
So we do provide a multitude of services at Hillside, everywhere from inpatient rehab. So if you went to a hospital, you got debilitated, you needed to go somewhere for rehab before you go home, we provide that at a most intense level. So by intense, I mean the most amount of therapy that you can get. So more therapy than a skilled nursing facility, more therapy than an outpatient setting. From there, we go into our outpatient clinics. So we have outpatient therapy here at Hillside and also our Austintown location. So physical therapy, occupational therapy, speech therapy on an outpatient basis for both adults and pediatrics. Other services we provide that are a little more specialized, we provide lymphedema occupational therapy. So for those who are experiencing excessive swelling and fluid in their extremities, we provide treatment for that. Speech therapy, we provide treatment for swallowing, for cognition. We do what's called modified barium swallows to see clinically how well a patient can swallow and what kinds of liquids they can tolerate. Really important for a post-stroke patient or a post-brain injury patient.
What condition does a patient need to be in to have to come to Hillside?
So we take patients virtually of all conditions to come to Hillside. The main thing is that there's a functional change. So before you went into the acute care hospital, you were independent, maybe you needed a little bit of help, and then after your inpatient stay, whatever illness you had really knocked you out, and now you're requiring increased assistance. Your functional level has decreased. So now that qualifies you to come to Hillside. It's that functional change, seeing that you've had a big setback in your life.
What's your process of working with a patient?
Basically, physical therapy here does usually 2 hours a day with the patient. So we come down to our therapy gyms where we have a lot of equipment to use, and we basically work on their function. What do they need to do to go home? So that involves walking if they're able to walk, strengthening exercises, endurance training. We talk to the families a lot to find out if they can either come in for instructions or we do it over the phone to make sure that they're able to manage the patient's needs when they go home. So primarily we focus on their function to get them home.
How prepared are families to take on these roles? How much coaching do they need to assume these roles?
It varies quite a bit, and we really have to talk to the family to find that out, because there will be patients that need an extensive amount of care, and we would be apprehensive to send them home that way. But the family comes in and they show us that they're able to do that. And then we have other people that go home with relatively little help needed, and those we can generally talk over the phone and kind of discuss what they might need when they go home. So I'd say it really varies with the family. Some people don't have anyone to go home to, and we have to do a lot of extra planning for those patients to make sure they're taken care of.
How have you had to adapt to COVID? Obviously, we're here every day. We need to physically distance. How does physical therapy adapt to that?
And that's a great question, because physical therapists, occupational therapists, speech therapists, we are very used to being, connected to that patient. And sometimes we have to be to help them walk, to help them eat, to help them bathe, dress, work on swallowing. So making sure that we are as safe as possible, mask on at all time. When we're seeing patients, we have eye protection on, whether it's a face shield or goggles. Following all the standard PPE guidelines based on that patient's diagnosis. So making sure we have the right equipment for what we're doing. Making sure that we're sanitizing all equipment between patients. I mean, we've always done that, but now it's just an even greater attention to detail, making sure that we're hitting every little thing and being as safe as possible at all times. All of our inpatients here at Hillside, they're all screened for COVID, both with a verbal screening, but they're also tested prior to admission, so that we're making sure that our patients remain as safe as possible.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit BusinessJournalDaily.com. For all of your arts and entertainment news, go to AfterHoursYoungstown.com.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.